On a similar subject, from Kerry Rogers.
Mr Hockey, I'm a registered nurse who lives and works in the area. You've managed to achieve something that I didn't think was ever going to be possible. You've managed to galvanise every sector of the healthcare sector against your co-payment. The AMA, the Doctors Reform Society, the ANMF, medical and nursing leaders, health economists are all opposed to your co-payment. This affects those with chronic and complex care needs the most, and it affects those with the least ability to pay. It's unfair in the extreme. These people will delay presenting for treatment to their GPs because they can't afford the co-payment. They'll end up in our emergency departments and may then need to be admitted to our hospitals, which is a much higher cost to the entire system, let alone the cost to those individuals physically and emotionally. This is absolute madness. This attack on Medicare and universal healthcare is driven by liberal ideology, not necessity. How can you justify a $7 co-payment when we're only spending 9% of GDP on our healthcare system, less than half of the USA?
Ma'am, I understand what you're saying and I respect where you're coming from. Do you think the United States has a better health system than Australia?
No.
Okay, well they're spending
They're
spending twice the amount that we're spending, and they haven't got a better system, and I share that view with you. But the challenge is, ma'am, how do we make sure that the health system we have gets better and better over time? That's the question we face. And at the end of the day, someone has to pay for it. It's always the taxpayers. Someone has to pay for it. Now, what we have to do is when we have projects like this or initiatives like this, we have to ensure that those most vulnerable and those most exposed have an appropriate safety net. And that is what we've actually done by having, of the $7, again, $2 going to the doctors so that they can then determine if someone is in real trouble, and they will obviously not charge. Secondly, it's only 10 visits a year for anyone under the age of 16 or a concession card holder, which is millions of Australians. And thirdly, if you have a chronic disease or some serious affliction that is being managed by the doctor, you will not have to pay the co-payment.
I'll quickly go back to our questioner who's on her feet.
I say to you that our healthcare system is one of the best in the world. We have been judged by Bloomberg as being the 7th most efficient healthcare system in the world. We have a world-class healthcare system. You are trying to destroy that system.
I don't accept that.
People will not be able to pay 10 visits a year at $7 a co-payment is far too much for people to pay. I don't think you've heard a number of people in the audience tonight tell you that they cannot afford in a fortnight. That's the difference between someone putting bread and milk on the table for their children or going to the doctor. These are the choices your government is forcing people into.
Okay, we're going to take that as a comment.